Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been quite concerned lately about my blood pressure. I noticed it was higher than usual during my last checkup, 166/80. Honestly, I had been slacking on taking my lisinopril regularly. I've corrected that, but I'm anxious about any damage it might have caused during that lapse.
It's good that you've restarted your medication. Fluctuations in blood pressure can indeed pose risks, but resuming your treatment is a significant first step. How have you been feeling overall? Any headaches, dizziness, or other unusual symptoms since then?
No, nothing like that. I feel fine physically, but it's the worry that maybe I've undone some of the good progress I had made. Besides the blood pressure issue, managing my diabetes is always on my mind. My last hemoglobin A1C was in the excellent range, thanks to the glyburide, but it's a constant balancing act with my diet and exercise.
You're doing well managing your diabetes. Keeping active and losing weight as you have is commendable. How about your diet? Have you made any recent changes or faced any particular challenges?
I've been trying to stick to a balanced diet, more plant-based, less processed food, and it's helped with the weight loss. But it's tough, especially being unemployed and on a tight budget. The job hunt is stressful. As a former project manager, I'm not used to being idle.
That does sound stressful. Unemployment can certainly add to your overall stress, which can indirectly affect your blood pressure and diabetes management. How are you coping with that stress? Do you have support from family or friends?
Yes, I do have support, which helps. But there's always this underlying worry about my health and job situation. Recently, I started walking more, about 3 miles a day when the weather allows. It clears my mind.
Walking is excellent for both your physical and mental health. Let's review some of your recent test results to ensure everything is on track. Your latest blood pressure readings are much better. Morning at 122/78, afternoon at 130/85, and evening at 118/76. These are within the normal range, which is great.
That's a relief to hear. And how about my other tests, like my blood sugar and cholesterol?
Your fasting blood glucose is stable at 98 milligrams per deciliter, and postprandial levels are well controlled at 140 milligrams after meals. Your lipid profile shows total cholesterol at 185 milligrams per deciliter, with LDL at 100 milligrams per deciliter, and HDL at 55 milligrams. Triglycerides are at 150 milligrams, which are slightly elevated but not alarming.
And my kidney and liver functions? I remember from my past experiences they could be affected by my medications and conditions.
Your kidney function tests show a serum creatinine of 1.2 milligrams and an eGFR of 60 milliliters per min, 1.73 meters square, indicating mild impairment, likely related to your diabetes. It's something we'll continue to monitor closely. Liver function is normal with ALT at 30 ULO, AST at 28 ULO, and total bilirubin at 0.9 milligrams per deciliter.
Okay, that sounds manageable. What are the next steps then?
First, continue taking your medications regularly. I'll write 90-day refill to make it easier for you. We'll also schedule a follow-up in 3 months to monitor your blood pressure and kidney function. In the meantime, keep up with your walking and diet efforts.
Thank you, doctor. It's good to know exactly where things stand. What about my eyes? You mentioned a diabetic retinopathy exam.
Yes, that's scheduled for next month. It's crucial to monitor for any changes that diabetes might cause to your eyesight. We'll also do a routine eye exam to update your prescription if needed.
Sounds like a plan. I appreciate your help and the thorough explanation of my results.
You're welcome. Remember, managing these conditions is a team effort. You're doing your part, and we'll continue to support you every step of the way. If you have any concerns before our next appointment, don't hesitate to contact us.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
I've been feeling pretty frustrated lately because of my health. I know my blood pressure has been up and down, and honestly, I haven't been doing much to help it. I stopped going to the gym 3 months ago, just felt too tired all the time, and got into a bit of a lazy routine.
I understand that can be challenging. How have you been feeling overall, aside from the blood pressure issues?
Well, I spend a lot of time in bed, just don't have the energy. I've tried to keep up with some light activities, but even that feels exhausting. And then there's the back pain I had a few weeks back. Thought it might be something serious, but it turned out to be a ligament issue, and it resolved on its own.
It's good to hear the back pain resolved. Now, about your blood pressure. How have you been monitoring it at home?
I check it occasionally. The readings have been high, sometimes hitting 150s over 80s. My doctor suggested starting on amlodipine recently, so I've been on that. I hope it helps.
It's important to keep monitoring that. Have you had any other recurring symptoms or issues lately?
Yeah, there's the postnasal drip. It's been causing me to cough a lot, especially at night when I'm trying to sleep. It's been quite bothersome.
I see. That can definitely affect your sleep. How about your diet and lifestyle? I recall you mentioned trying to manage better.
I do try, but it's tough. I sometimes grab fast food, though I know it's not the best for my blood pressure or kidney function. I mostly eat chicken, but yes, it's often processed, like chicken nuggets.
Diet can really impact both your blood pressure and kidney health. We'll need to keep an eye on that. Now, you mentioned your kidney function was around 50% the last time it was checked?
Yes, that's what the tests showed. They say it's medical renal disease. I've been trying to follow the guidelines to manage it, especially focusing on my blood pressure.
It's good that you're aware and taking steps. Have there been any other recent tests or procedures?
I had an echocardiogram done not too long ago, and they didn't find anything worrisome, which was a relief. I'm also scheduled for a colonoscopy soon, just had the labs done last Friday to prepare for that.
It's good to stay on top of these screenings, especially given your health history. Have you noticed any other changes or concerns?
Not really, just the general tiredness and occasional cough from the drip. It's more about managing what I already know and hoping there aren't any new surprises.
Understood. Let's go over some of your recent clinical values to see where things stand. Your blood pressure today was 145/85 mm/Hg, which is slightly high. Your latest fasting blood glucose was 128 mg, and your hemoglobin A1C is at 6.5%, which indicates relatively good diabetes management. Your BMI is 27.5, so it's in the overweight range, which could be contributing to the tiredness and blood pressure issues.
I figured the weight might be part of the problem. It's been hard to get motivated.
Yes, weight can impact energy levels and overall health significantly. Your serum creatinine is 1.9 mg/dL, which is elevated, and your eGFR is 45, indicating that your kidney function is consistent with moderate chronic kidney disease. Your cholesterol levels are also a bit high, with total cholesterol at 202 mg/dL, LDL at 130 mg, and triglycerides at 210 mg/dL.
So it sounds like there's a lot I need to work on.
Yes, but you're not alone in this. We'll work together on a plan to improve these areas. It will involve adjustments in medication, possibly enhancing the amlodipine if your blood pressure doesn't settle, and definitely more attention to your diet and physical activity levels. We'll also continue to monitor your kidney function closely to manage your renal disease effectively. Let's aim for regular follow-ups to keep track of your progress and make any necessary adjustments.
Thanks, doctor. I appreciate the clear breakdown. I know I need to make some changes, and it helps to understand exactly where things stand and what I can do about it.
Absolutely. We're here to support you every step of the way. Let's schedule your next appointment, and we'll review everything again.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
We need to revisit the protocols on patient privacy. There have been a few instances where sensitive information was overheard by unauthorized staff.
Yes, doctor. I've noticed that too. We might need to reinforce the importance of discussing patient details only in private settings.
Exactly. And remember, even when you think it's just small talk, any patient information must be treated as confidential. For instance, discussing patient conditions in the elevator or the cafeteria is completely off limits.
Understood. I'll arrange for a refresher course on confidentiality and make sure all new staff are properly briefed as well.
That's a good start. Also, we need to ensure all electronic records are secure. Double check that you're logging out of systems when not in use.
Will do. I'll also check with IT to ensure our automatic log-off settings are functioning correctly to prevent any accidental access.
Now look at question 26.
Welcome everyone. Today we'll dive deep into the essentials of proper medical record keeping. Accurate and meticulous records are the backbone of quality healthcare. They provide a historical account of patient care and are crucial in clinical decision-making. Every entry must be made in real time to reflect the patient's current condition and treatment accurately. Remember, these records can also be audited by regulatory bodies, so compliance with legal standards is critical. Mismanagement of these records can lead not only to poor patient outcomes, but also legal repercussions. We must use consistent terminology and be as detailed as possible while still being concise. Furthermore, safeguarding the privacy and security of medical records is a responsibility we all share. This means adhering to protocols for electronic records, including secure passwords and access rights that reflect an individual's role within the healthcare team.
Now look at question 27.
It's important for us to discuss your eating habits openly and without any judgment. How have you been feeling about your eating lately?
It's been tough. I find myself eating a lot at once and then feeling guilty and purging. I don't know why I can't stop.
What you're describing sounds like bulimia. It's a serious eating disorder, but it's treatable with the right support. Many people recover and go on to manage their eating habits healthily.
Does that mean I can get better? How do we start?
Absolutely. Recovery is a real possibility. We'll start with some counseling sessions and consider a nutritional plan that suits you. It's also important to work on the emotional triggers that lead to these behaviors. I can refer you to a specialist who can provide the appropriate therapy.
I'm relieved to hear there's help. I felt so alone with this.
You're not alone, and it's brave of you to seek help. Let's take this one step at a time together.
Now look at question 28.
Today, we'll focus on understanding and managing the behavioral changes often seen in dementia patients. As caregivers, it's critical to recognize these behaviors as potential expressions of unmet needs. Agitation, for example, could signify discomfort or frustration. By adjusting our approach, speaking calmly, maintaining eye contact, and using reassuring touches, we can provide comfort. We also need to adapt the environment to reduce confusion and anxiety for these patients. This might mean creating a more predictable routine or minimizing noise and clutter. Implementing these strategies requires patience and empathy. Always observe the patient's responses and adjust your approach accordingly. Remember, your goal is to minimize stress and promote a sense of safety and familiarity, which can significantly reduce challenging behaviors.
Now look at question 29.
Let's walk through your billing statement together. I see here a few entries that might need clarification. Let's address any concerns you have.
I'm puzzled about this line item here. It mentions a procedure that I don't recall undergoing.
That's a good catch. Let's flag that for review. Sometimes billing codes can be entered incorrectly. I'll have our billing department revisit this and ensure any errors are corrected.
Also, this medication charge seems high. Wasn't it supposed to be covered by my insurance?
Let's check that as well. Different insurance plans cover different medications at various levels. I'll have someone from our team contact your insurance provider to sort this out.
Thank you, doctor. I appreciate you taking the time to help me understand these charges.
Of course, it's important you trust and understand every part of your care, including billing. We'll get to the bottom of this together.
Now look at question 30.
Welcome to today's training session on the critical topic of medication error reporting. The reality is, errors happen, but our response to them is what matters most. Effective error reporting is not just about acknowledging an error, but also about initiating a process to prevent future occurrences. It starts with transparency. Being open about mistakes allows us to learn from them. Once an error is identified, document it thoroughly in the patient's record and notify the necessary supervisory personnel. We will then analyze what went wrong and why, which helps in developing strategies to improve our practices. Remember, the goal of this process is to enhance patient safety and care quality. Let's all commit to a culture of safety where every member feels responsible and empowered to report and learn from errors.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
We're diving deep into a complex and significant topic within critical care and emergency medicine: the use of balanced crystalloids versus saline in fluid therapy. Recent studies and debates have raised questions about the optimal choice for various patient scenarios. To illuminate this discussion, we'll explore the findings from the SMART and SALT-ED trials and integrate them with a case study from a recent patient encounter.
Absolutely, and thank you for having this discussion. The choice between balanced crystalloids, like lactated ringers or plasma light, and normal saline could seem nuanced but has profound implications for patient outcomes. Let's start with a brief overview of the key findings from the SMART trial conducted at Vanderbilt, which was a large pragmatic trial comparing these fluids in the ICU setting.
The SMART trial indeed provided significant insights. It was structured as a cluster randomized, multiple crossover study involving over 15,000 patients across 5 different ICUs. They alternated the type of fluids administered every month, which included either saline or balanced crystalloids. The primary outcome measured was a composite of death from any cause, new renal replacement therapy, or persistent renal dysfunction.
And the results were quite telling. They found that the use of balanced crystalloids led to a lower rate of the composite endpoint than saline, with a 1% absolute reduction in adverse kidney events. While this might seem small, the large sample size of the study provided the power necessary to detect this difference, suggesting a real benefit to using balanced crystalloids in the ICU setting.
That's a great point. Now let's integrate these findings with a recent case that came into our hospital. We had a 58-year-old male patient with a history of chronic hypertension and type 2 diabetes who presented to the emergency department in septic shock. Initially, he was resuscitated with normal saline during the early hours of his treatment.
This is a typical scenario where fluid choice can have a significant impact. In line with the SMART trial's findings, our initial use of saline could potentially contribute to hyperchloremic acidosis and kidney stress. Once he was transferred to the ICU, considering his deteriorating renal function, we switched to a balanced crystalloid. This decision was based on evidence suggesting that balanced solutions might reduce the risk of acute kidney injury in such patients.
Indeed, and reflecting on the patient's outcome, after the switch to balanced crystalloids, his renal parameters stabilized, and he did not require renal replacement therapy. This case underscores the practical implications of the research findings from the SMART trial and others. It also brings us to the importance of hospital protocols that can adapt based on emerging evidence to optimize patient care.
Absolutely. The adaptation of hospital fluid management protocols to incorporate the use of balanced crystalloids for certain subsets of patients could be a significant step forward. Another point to consider is the role of patient-specific factors. The choice of fluid may depend on the individual's overall health condition, presence of comorbidities, and the specific clinical scenario.
That brings us to the broader implications of these findings. While the SMART trial provides robust evidence favoring balanced crystalloids in a mixed ICU population, we must consider how these results translate into other settings, such as the emergency department or in non-critically ill patients, as explored in the SALT-ED trial.
The SALT-ED trial indeed expanded on the findings from SMART by including non-critically ill patients who were admitted to the hospital from the emergency department and required intravenous fluids. The trial also favored balanced crystalloids over saline, showing reduced rates of major adverse kidney events. It's important to highlight that patient outcomes can be subtly influenced by the initial choice of fluid therapy, emphasizing the need for early intervention with the appropriate fluid type.
While the evidence tilts in favor of balanced crystalloids over saline, especially in critically ill patients and those at risk of renal complications, the decision should be tailored to each patient's unique clinical situation. Continued research and clinical trials will be crucial in further refining our understanding and guidelines regarding fluid therapy in various patient populations.
Thank you for such an enlightening discussion. It's clear that the choice of fluid therapy is not just a clinical decision, but a critical component of patient care that can significantly influence outcomes. As we continue to gather more evidence, the ongoing adaptation of clinical practices will be key to improving outcomes for all patients requiring fluid resuscitation.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
We're here to delve into the complexities of chronic migraine management, a topic that is often at the forefront of neurology research due to its significant impact on patients' quality of life. A pivotal study, which I'll refer to throughout our discussion, has provided substantial insights into how we can better manage this debilitating condition. To set the stage, let's consider a recent case study from our clinic. We encountered a patient, let's call her Sarah, a 38-year-old graphic designer who presented with a history of migraines that have progressively escalated to chronic migraine. Over the past 3 months, Sarah reported having headaches on more than 15 days each month, with at least 8 of those days fulfilling the criteria for migraine. Her situation exemplifies the typical chronic migraine patient, as defined by the International Classification of Headache Disorders. The CAMEO study, a seminal research piece in our field, utilized a large-scale population sample to explore the nuances of migraine impact on quality of life. This study, conducted over the web, engaged participants who were demographically representative of the broader U.S. population. Participants like Sarah completed various validated questionnaires to assess migraine frequency, severity, and associated quality of life impacts. One critical finding from the CAMEO study was the direct and mediated effects of headache frequency on quality of life. The study used the Migraine-Specific Quality of Life Questionnaire, MSQ, to measure this. What's particularly interesting is the differentiation of effects, direct versus mediated. The direct effect, unsurprisingly, shows that reducing headache frequency directly improves quality of life. However, about 10 to 20% of the improvement in quality of life was mediated through alleviation of related symptoms such as allodynia, depression, and anxiety. Sarah's treatment was aligned with these findings. Initially, we focused on reducing her headache days through preventive pharmacotherapy and acute treatments. However, acknowledging the mediated factors, we also integrated a psychological approach targeting her mild depression and anxiety, which are common comorbidities in chronic migraine sufferers. Let's delve deeper into the aspect of allodynia, which is pain sensitivity that can exacerbate during migraine attacks. In Sarah's treatment protocol, addressing allodynia early in the migraine attack was crucial. This was done through both medication and lifestyle adjustments aimed at reducing sensory stimuli, which are potential triggers for her migraines. The broader implication of the CAMEO study for clinical practice is quite profound. It suggests that while it is vital to decrease the number of migraine days to enhance quality of life directly, addressing comorbid conditions like depression and anxiety is equally important. These findings advocate for a holistic approach to migraine management, one that considers the physical, psychological, and emotional dimensions of the disorder. From a research perspective, the CAMEO study encourages ongoing exploration into the fluctuating nature of headache frequency and how this variability influences the chronicity of migraine. It challenges the rigidity of current diagnostic thresholds for chronic migraine, proposing a more fluid understanding that accommodates the natural variation in headache patterns over time. The case of Sarah and the insights from the CAMEO study emphasize the complexity of managing chronic migraine. They highlight the need for personalized treatment plans that not only aim to reduce headache frequency, but also enhance overall quality of life by addressing the full spectrum of symptoms and comorbid conditions. Our goal as clinicians should be to provide a comprehensive, multidimensional approach that genuinely transforms the lives of our patients. Thank you for your attention. I hope this discussion provides a clearer understanding of the intricate interplay between headache frequency and quality of life in migraine management and inspires further research and refined clinical strategies in this field.